So I got this. I'm trying to find it here. It's a great little statement that says, "Pay attention to companies, how companies treat their employees during this time. It speaks volumes to their core ethics."
Yeah, right.
And I was thinking, now is the time where you can't fake it. You can't fake it in a crisis.
No, that's right. You either care about your people or you don't, I think.
Yeah, that's right. Yeah. So how's it going at INL with your team?
So we transitioned everybody early last week, as many as possible, to telework.
Okay.
So we're probably at about 30%, headed towards 40% of our workforce teleworking.
Okay.
So that in and of itself was an amazing feat, and it didn't come without obstacles. We had, you can imagine, the various IT and related obstacles. Our IT team did a great job, so I think that's settled. And now the question is, if things continue to escalate in our area, we're going to have to start looking at additional restrictions, because right now all the people who have to be on site to do research are going to work.
Okay.
We're just practicing social distance and virtual meetings and all of that. But as this escalates, we'll have to cut back that too. And so the challenges will ultimately, if it escalates in our region, we'll ultimately be at more like sort of 70-80%.
Okay.
Trying to. So when we get into minimum safe operation, we're looking at 600-800 people total out of the 5,000 that can that have to work. So
yes. So my big question on that, and I've been reading about this, is from a leadership perspective, when you have that many people dispersed out, as a leader, how do you, the old leadership by walking around doesn't work anymore.
Yeah, it doesn't. So what I've done is I did a video that got widely distributed inside, and then I'm doing a lot of messages, all employee messages, various sorts, and trying to just continue to try to just tell people what's going on as best I know it, but also more for morale.
Yes. Yes.
And I stay in contact with the senior leadership daily on phone calls, but you can't do a 5,000. You could, but it's hard to do a 5,000 person telecon. So it's mostly messages. Yeah.
Okay.
Because I can't get around. The people that are out there working are the ones in particular that I think, the people that are teleworking, we've got them at home. Their risks are minimized, not completely gone, but it helps manage the risk. But we've still got people working, and those are the ones that I worry about the most.
Right.
Because they're at home. So, but it's a challenge. And it's also, how do you manage, all the way down to the first line supervisor, how do they communicate with their people when they're teleworking? So we're trying to use Teams, we're trying to use Skype, we're trying to use Blue Jeans as much as possible so that there's this kind of face-to-face interaction.
Yeah, same thing. We relaxed our dress code. And trying to communicate as much as possible. We went to those branches that have drive up or drive through windows, using them so that we can minimize direct person-to-person contact.
But you can't. It's hard to run a complex operation like INL.
Oh, I bet.
In a telework. So. And also, as I said, as this escalates and we have to limit even more, it gets more and more complex. I won't say we're a step ahead. We're kind of taking it day by day. I mean, we're prepared. We're prepared for the next thing. We've done a lot of planning.
Yes. Well, I look back at. I'm sure you're required to do all these desktop disaster planning and how many hours we've put in on those, and you're like, oh gosh, do I really have time for this? And I'm so glad we did.
Yeah, no kidding. Yeah, we call it COOP plans, continuity of operations. You probably call it something similar. Yeah. But now it's actually working.
Yes, that's right.
It's not perfect, but this is, you're seeing it as well. I mean, this is unprecedented, right?
Oh yeah.
You just don't really know what tomorrow is going to bring. So
it changes hour by hour.
Yeah.
Just
make the best you can.
That's right. Stay very nimble.
Right.
And so we're coming together on this community nonprofit effort, and I wanted to ask you kind of how you felt about it, where you saw the need for this.
Yeah, you bet. So well, first of all, thanks for your leadership and having us do this. I'm happy to partner with you on it.
This is great.
It's awesome. Called the East Idaho Community and Commitment Fund.
Yes.
And we've both agreed to come together. A very talented group of people who are helping us think through the specifics. But to me, as you think about Eastern Idaho and all the amazing work that the nonprofits do in this area to help people who are less fortunate with food, shelter, daycare, all those things. I mean, it's a very amazing, giving community. But these are trying times, so I think it's great that we're coming together and providing some. We provide a lot of resources already to the community, both our organizations, but providing a little bit extra. And so, and I think if we step up, that entices the rest. I think that'll entice others. So
I hope so. I hope so. I don't know what you're seeing, but all the cancellations of, say, the symphony and all these different events going on. People aren't buying tickets. They're not attending these nonprofits, as well as the need for housing and food and basics. That's where I really worried that, gosh, these nonprofits are really going to need an extra shot in the arm. They can't be ignored.
Yeah, that's a great point. And and I'm also watching. Related the way the schools, the local schools, when you have kids who need the lunch program and the breakfast program and whatnot, and District 91 and 93 are really stepping up in our local area on that. But there's going to be people out there who to your point, their resources are going to be strained.
Yes,
their people and their dollars, and so I think the more we can do to inject money into that and help and let them guide where the priorities are.
Yes, that's right.
And we provide additional resources. I think that they're expert at it. So give them the extra resources and let them go help people.
That's right. That's right. Wow. The other thing that you mentioned early on, and I want to reiterate it a little bit, is the leadership we're seeing from the city. The mayor, I think, has done a great job in communication, and the county and state, and you've seen that as well.
Yeah, and I've seen that definitely. Just an example, the mayor's video that she did early on last week was, I think, really great. But also the incident command has been stood up, and that's got all the various, city entities and emergency responders, and we have a seat at that table because of our footprint in the area, and that's working very, very well. And working with also the health district, the Eastern Idaho Health District, and so I'm feeling really good about that. So I feel like we're ready for what tomorrow brings. But the communication's been stellar, I would say. Yeah,
that's great.
So
that's great. Well, we'll certainly get through this. And the other thing I think about is, and I love your perspective on this, is what kind of things are we going to take away from this? Our lives will never be the same after this, just like the Great Recession impacted us. What do you kind of see as, or foresee as, some of the learning,
interesting,
or some of the lessons?
Well, Well, I think, yeah, I mean, there's the lessons related to listen, I'm a scientist, so I'm going to say this, of course, but listen to the science, right?
Yeah.
So 'cause I think the science said that, this was headed towards a pandemic, and I think we could have responded as a society, I'll say,
Yes.
sooner. I'm not saying it would have made it go away. We would have still been dealing with it, but I think some of the strains that some areas are seeing on hospitals, like you're seeing in Italy, like you're starting to see in Spain, or like we're starting to see even here in New York, for example, I think some of that could have been perhaps, mitigated, I would say, if we would have started responding sooner. And the science suggested that we needed to. So I'd like to think that we'll listen to science early the next time.
Yes.
Also, I think the scientists are learning a bit about how to better. I mean, we're in the midst of trying to figure out antivirals and also vaccines. And there's a lot of amazing scientists addressing those challenges, but I think we can learn more next time about how to do that even faster. There's that, those are key things.
Yes.
But a lot of this, I can't say the importance of social distancing, simple. Go to virtual meetings. That's been people have been saying that for a while.
Yes.
And we still see people who aren't following it. Yes, it's a change in the way you do, change in the way of life. But I think what a big thing is we need to understand is you need to be inconvenienced to be able to manage through these things.
Yes.
And I think people are learning that now, such that the next time will be better.
Yeah.
Anyway,
Yeah.
just some.
I think. Yeah, I think one of the things
I've learned about how to, you learn management stuff. We're certainly not doing it now, so just learn. You take some lessons away, but.
Yeah, one of the things I think about is just how mobile you can get your workforce to be. Yeah, and what is that going to look like with big office buildings if we can deploy more people remotely and they can be with their families, maybe have a better quality of life there. It opens up some interesting questions as a leader.
Yeah. To your point, that's a great point. And who knows? We could come out being more efficient and productive, actually, right?
That's right.
I mean, some of our work requires hands-on. You can't get away with it,
That's right.
Away from it. But I mean, it could be that we become more efficient and productive, and we have better work-life balance.
That's right.
Yeah. So it's kind of ironic that it takes. It shouldn't take something like this to realize that, but that's a great point.
You always, any time in life, you have these kind of trials. You get something. That's where you really have learning. That these big jumps and paradigm shifts happen during these times.
Yeah, but like you said at the beginning, if you care about your people, I think you manage and lead through these things, and the organization's better for it. But I think if you wake up caring, you're in a much better place than not. So
that's true.
That's what's guiding me a lot every day. I just think about the fact that I'm one of 5,000, but I've got a role to play, and I do everything I can to help.
Yes. Well, I got a call from one of our small businesses on Sunday afternoon, and she was talking with her husband, and they were really worried. They had some concerns. And they said, well, let's call Jeff. And they said, we're so sorry to bother you on a Sunday, but we're really worried. And they had some of these financial commitments, and they've been longtime customers. And I said, we have your back. We got you. You will move forward. We'll work with you. It's going to be okay. It's going to be okay. And I talked to her this morning, and I said, so how'd you sleep last night? And she said, I slept so well, because I knew I was going to be taken care of. And so here's the opportunity to really put your money where your mouth is. It's easy for people to say, oh, yeah, we care about you. But during these times, we really get to show it. And
that's right.
It's heartwarming for me to see the little impacts that we can make out there.
No, good for you. Good for you. That's you're just a good human.
You're a good partner, my friend.
No, likewise.
It's fun to be able to partner with you on this. And what would you say? How can we get others kind of jazzed up about this? Other community leaders. What would you say about that?
Well, let's get the word out through this mechanism first, and then I think we need to start making some calls. We need to start making some calls.
You got it.
Because full well there's going to be a lot of folks who are going to want to step up.
Yes.
They just need to be made aware of it.
Yeah, there's such generous people in this town.
Yeah, so just get the word out, and then I think we'll be amazed.
Yeah, great. Well, Dr. Peters, thank you so much. I appreciate you as a partner, and most of all, I appreciate you as a friend.
Likewise, and please take care, Jeff. Okay.
You too.
All the best. Stay well.
Bye.